What do you make of the fact that African Americans are, even according to statistics, doing worse when it comes down to the coronavirus?
Well, when we look at the impact within the African American community in connection with the COVID-19 crisis, this is merely a harbinger of the socioeconomic deprivations that the African American community has experienced over time. When we think in connection with the ability to obtain or acquire health care, oftentimes this runs parallel with employment. Many employers, I want to say middle to upper level echelon employers, offer health insurance. But oftentimes you have instances where African Americans will acquire employment from employers that may not offer health insurance. And so we look to the African American community as a disenfranchised community on many aspects. And this is merely a reflection or a harbinger of what has been going on for years on end as a result.
All right, so Joseph, at this time, from what I've understood, is the CDC has not released a breakdown of how the different races have been affected by the COVID-19 pandemic. What do you make of how important such statistics would be, considering we're already seeing African Americans being affected, as I said, in those specific cities and otherwise?
It's critically important, mainly because you can't solve a problem unless you know what it is and unless that problem is defined. And if you have preliminary data showing that this is a huge problem, then you need conclusive data in order to figure out how to fix it. As your previous guest, Derek, said, this is laying bare a lot of inequities and a lot of social determinants that we kind of knew were there, but this is happening in real time, and it's happening with a real body count. Usually these sorts of discussions, a lot of it is theoretical, a lot of it is statistical, but right now you have a situation where people are actually dying. So these are situations that we've known about for a long time. It's not just about healthcare, employer-sponsored healthcare, although that is significantly a part of it. It is also about living conditions.